One of the most gruesome stories I reported on in my 25 years on the Fifth Estate started out as a good news story and turned into a horror show.
They began taking human tissue from cadavers and transforming it into an exciting new medical product. It was called Lyodura and was made from the strong connective tissue surrounding the brain.
It worked like a bicycle patch, sealing surgical wounds. Surgeons loved it. But what they did not know was that some of the raw material was stolen from corpses. Some was contaminated with deadly disease. Health Canada approved it without question or testing.
We had become more oriented to business promotion than health protection.
A senior scientist at Health Canada became suspicious when a number of Canadians developed symptoms of a brain-wasting disease.
It strikes only 1 in a million, and it almost never occurs in anyone under the age of 60. It always results in death.
He was blowing the whistle, but nobody was listening. The Food and Drug Administration had not approved Lyodura for sale in the States. But when a 20-year-old Connecticut woman died of the brain-wasting Creutzfeld-Jakob disease, they began to investigate. She had been implanted with Lyodura, and it had come through the mail illegally from a distributor in Montreal.
God forbid you are the person or the family member of a person who wound up with a completely preventable illness and there were adequate alternatives.
Turns out the German pharmaceutical company had been lying to Health Canada about screening donors, about keeping records, about causing cross-contamination. The plug was pulled on Lyodura in 1996, 9 years after the connection was made. The company refused to give us an interview. Health Canada's Julia Hill also refused to talk about Lyodura. It remained on some hospital shelves and continued to be used. More horrifying is the fact that Creutzfeld-Jakob can incubate up till 20 years before symptoms appear. That is a cautionary tale if ever there was one.